Hi, my name is Michaela Mendez and I'm a registered nurse. In this presentation, I will be discussing the contribution my intervention had on my family member. I will describe the use of evidence and peer-reviewed literature, healthcare technology, and health policies. I will explain project outcomes as well as assess my personal growth throughout the capstone project for the RN to BSN program. Throughout this project, I chose the health problem obesity. Obesity is characterized as overweight. It is a disorder that involves too much body fat, causing individuals to be at risk for numerous health problems. It usually occurs from too many calories being consumed, which exceeds the amount that are being burned. An adult body mass index, or BMI, of 30 or greater is classified as obese. Obesity is one of the leading health problems in the world. In the article, a systematic literature review on obesity written by Safai in 2018, it states, obesity and its attendant conditions have become major health problems worldwide, and obesity is currently ranked as the 5th most common leading cause of global death. Knowing that it increases the risk for other health problems, some of these health problems can include heart disease, cancer, and diabetes. Symptoms that can be seen with obesity may include fatigue, depression, difficulty sleeping, aches and pains, excessive sweating, and shortness of breath. Once diagnosed with obesity, it cannot be cured but needs to be maintained by losing the proper amount of weight in a healthy way and taking anti-obesity medications. My target population is a family member. This family member is diagnosed with obesity and has agreed to let me interview her for the health problem obesity. This family member is my grandma, Diane. My grandma wasn't always obese. When she was younger, she was very active and healthy. As she got older, she started to develop some problems in her knees. This caused her to be less active. She went through 3 knee replacements and over time had gained weight due to inactivity. She was put on medication for her knees that caused swelling and water weight. She developed heart problems due to the excess of weight and fluid. This is an example of how obesity can cause other health problems. She has had 2 open heart surgeries within the past 3 years and sees cardiology routinely. She has a home nurse that comes to check on her regularly as she has had an implantable cardioverter defibrillator or ICD placed. I have developed a pamphlet specifically for my grandma and her needs to go over some interventions for obesity. These interventions include physical treatment, emotional support, and patient education. Physical treatment involves a healthy diet, which includes whole grains, fruits, vegetables, nuts, and protein, filling out a food diary, scheduled eating times, and daily exercise. Emotional support involves depression screening, putting self-care first, and asking for help without hesitation. Patient education involves being aware of lifestyle changes that need to take place and why, knowing risk factors to be aware of, like lack of physical activity, increased level of stress, certain medications, hypertension, heart disease, high blood cholesterol and triglycerides, lack of sleep, and poor eating patterns, and then also knowing what signs and symptoms to identify and when to call her PCP if any of them occur. Overall, my grandma was pleased with the material she received and what we had gone over and discussed. She liked the idea of keeping a food diary and said she would bring one to her next doctor appointment to review with them. I used evidence-based and peer-reviewed literature throughout my capstone project to find accurate material about the health problem obesity. In the article, Nurse Educators Making a Difference with Evidence-Based Practice, written by Beckett in 2021. It states, evidence-based practice is a process to incorporate the best research that uses scientific evidence. In nursing, it allows quality care to be provided to the patients. To improve outcomes with a patient diagnosed with obesity, we discussed the healthcare technology AccuVein Vein Finders. These devices aren't talked about too much in nursing, but are used on a daily basis by IV teams in the hospital setting. AccuVein Vein Finders are handheld devices used to find hard-to-see veins quickly and accurately. It shows a vein map on the patient's skin so medical providers can find veins when trying to draw blood for procedures. I chose this type of technology to discuss since it's hard to find veins on patients with excess body fat. It interests me to know there is an easier way to find good veins since it can be very painful for some patients, especially if they have damage and scar tissue to their veins from getting blood drawn so often. My grandma is someone that has had to get blood draws often due to other health problems she has from being obese. When planning the capstone project, I discussed the State Board of Nursing practice standards in Pennsylvania when implementing governmental policies. In Pennsylvania, it concludes that the guidelines to consider a patient obese are having a body mass index or BMI of 30 or more for adults. Adults have 3 categories to obesity: Class 1 obesity 30 to 34.9, Class 2 obesity 35 to 39.9, and Class 3 obesity 40 or greater. Children and teens are often off of BMI percentile. They're considered obese when their percentile is greater than 95%. In Pennsylvania, 33% of adults and 18% of children are considered obese. According to the Department of Health, DOH, obesity is more prevalent in Hispanic and non-Hispanic Black individuals. This is also per the CDC. By having the ability to inquire this information allows healthcare workers to know what to expect from different cultural groups they can care for. This ensures the best possible care to be provided to the patient. Overall, my outcomes for obesity matched my initial predictions by discussing the interventions in the pamphlet with my grandma. My personal and professional growth throughout the capstone project and the RN to BSN program has increased significantly by learning how to build upon assessments and identify different aspects of my health problem, obesity. I was able to gain knowledge in this topic, provide patient education to a family member, and develop safe patient-centered interventions. All references will be included within this presentation. Thank you.